foster family we have 10 pets. They are 3 Westies, Saffron, Belle and Beau, 5 tortoises, Herbie and Bernadette, Amy and Sheldon and Penny, and we have the 2 rabbits who are Poppy and Daisy. And the fact that there is several dogs I find really helps, because we've got several children and everybody can have a cuddle at the same time and everybody can get that attention really. The children that we've had and young people that we've had have often spent more time with the dogs initially, because you can have a chat if you want to chat, you don't get quizzed, you don't get asked anything, and they're just lovely company. So this is what we call the den, and it's our semi-independent room, but this goes down really well. It's got its own entrance, it's got its own set of rules. It is somewhere to practice being independent but safely. We're all in the house, they've got access to the house all the time. I've got a key for the den as well, so it's still one home, but this is a separate area for privacy. We've got rooms in the house for younger, under 16-year-olds. This is probably my favourite and most important thing, and it's our welcome book. So we don't really discuss this book, it's just left on the child's bed and in their own time they just go through it. But what is so important to me, because it introduces our family, there's photographs of everybody that's in our house and a little bit about them as well, what things they like, how old they are. And I think that it's, in the early days, it can be so daunting, and it's like, who am I with? And it's actually really nice to have a little bit of an explanation. And they also can create talking points. Because food and meals are such a high anxiety area for nearly all of the children that we've had, I like them to know what's coming, and I like them to be able to plan and not worry about their evening meal. So we have a Monday to Friday system, and on Sunday I'll plan out what we're going to have, and they simply just tick their name if they want it. And I have found that since we've introduced this system, I'm not getting asked at breakfast what's for tea, because children were obviously concerned, they were asking the question, and it's there, they open it up, and it's really lovely because spaghetti bolognese always goes down really well, and on Sunday you can hear the little whispers, I can't wait till Wednesday. Before a new foster child comes to join our family, it is an anxious time, but I would say it's more exciting than anything else, and we've got a lot of trust in the county council for matching us to the right placement. So before that child arrives, we don't question, are they right for us, because we're confident that they will be. I would say to people thinking about fostering to ring the local authority and ask as many questions as you can. When I tell people I'm a foster carer, a lot of people immediately say, I've thought about that, or I want to do that, and haven't. And I'll always question, well, why did you not make that call, or why did you stop? And it's often a fear that could be just, I don't know what the word is, it could just be resolved so quickly. And sometimes just asking questions and makes you realise that the things you're worried about aren't really there, or you can speak to somebody that's experienced it and gone through it, and have come out the other side and think, actually no, it is a really rewarding thing to do. I can't see myself doing anything different.
Good morning, everyone. I'd like to welcome you all to this meeting of the Adult Social Care and Public Health Committee, which is being held remotely, broadcast live and recorded for publication, with the majority of the 11 members joining the meeting from their own homes. I'm Councillor Tony Harper and I'm the chairman of this committee. For the benefit of the viewers of the live stream, I'll now ask the clerk to the committee, Joe Toomey, to list other members and officers present today. Joe, please.
We have with us Councillor Bosniak, Councillor Butler, who's substituting for Councillor Dr. Doddy, and then Councillors Elliott, Fielding, Martin, Purdue Horan, Vickers, Vice and Woodhead, and I understand Councillor Sissons will be joining us during the meeting. And as well as myself today, we've also got the following officers present. We've got the Corporate Director, Adult Social Care and Health, Melanie Brooks, Director for Public Health, Jonathan Gribbin, Service Director, Living Well Services, Ainsley McDonnell, Service Director, Sue Batty, Director of Transformation, Grace Natoli, Senior Public Health Commissioning Manager, Lucy Jones, Health Improvement Principal, Matthew Osborne, Strategic Development Manager, Jennifer Allen, Project Manager, Social Care, Sharon Hales, Outbreak Director, Public Health, Kathy Quinn, Strategic Development Manager, Ian Haynes, Principal Occupational Therapist, Kate Bennett, and Senior Executive Officer, Jenny Kennington.
Thank you very much, Joe. We'll move on to item 1 on the agenda, which you'll find on pages 1 to 6 in your agenda pack, and it's the minutes of the last meeting, 7th of December 2020. Can we agree those minutes, please? Anyone against? Any abstentions? Thank you. I will take that as an assent. So that is accepted. Item 2 on the
Okay. The chairman's device has just crashed while he's attempting to come out of the meeting. In terms of apologies for absence, we have an apology from Councillor Dr. Doddy, who is being substituted today by Councillor Butler. We'll just
go to item 3.
Yeah, we'll just pause for a moment while we just restart the chairman's device and get any support that we need to.
Declarations of interests for members and officers. It's disclosable pecuniary interests or private interests. If you can declare those now, or if you find yourself through the meeting that you do have an interest, if you just want to raise your hand and we can pass it to officers then. Okay.
Yes.
Thank you. Are you back with us? Okay.
Sorry, apologies, Vice Chairman.
Oh, now Joe's frozen. Oh no, she's back.
Apologies.
Well.
Is he trying to get on? Is he trying to reconnect?
He is indeed, yeah. Yeah, if you want to proceed, Councillor Elliott, and then...
Okay. Let's go to agenda item 4, Your Health, Your Way, the Integrated Wellbeing Service Update. The purpose of this report is to inform the committee of the changes to the service arrangements of the Integrated Wellbeing Service, Your Health, Your Way. Prior to April 2020, separate health behaviour change services were provided to Nottinghamshire County residents. In order to integrate these services, Your Health, Your Way was commissioned to bring together smoking cessation, diet, physical activity, falls prevention, wellbeing and alcohol support into one service for the Nottinghamshire population. Your Health, Your Way has developed a My Story assessment process. This approach builds a picture of the client and the wider factors that may influence someone's attempts to change their health behaviours. This reflects a strength-based approach of using people's assets, such as their interests, passions and social connections, so that people are supported to achieve and maintain their goals. The national COVID lockdown restricted face-to-face working. Therefore, Your Health, Your Way has provided remote online services for the population, along with supporting the community hub and providing expert nutritional advice to the food insecurity task and finish group. The service has a recovery plan in place to support a return to safe face-to-face service delivery when social distancing requirements and legislation allows. The recommendations for this report are set out on page 12 of the agenda pack, and they are: 1. The members of the Adult Social Care Committee and Public Health receive future updates on progress of Your Health, Your Way via routine quarterly performance reports. And the second recommendation is that members of the Adult Social Care and Public Health Committee advise of opportunities for Your Health, Your Way to further engage with members of the public. I formally move the recommendations.
Second it.
Thank you, Francis. And hand over to Jonathan Gribbin.
Good morning, councillors. Yes, I'll just say a couple of words before introducing my colleague Matt Osborne, who, along with Lucy Jones, have been extremely busy mobilising this service. Were it not for COVID-19, this is something that you would have heard a lot more from us about much earlier in the year, because it represents a really significant change for us. Although there's so much about our health and well-being, which is really very strongly shaped by our environment, it's really important that as a council we also provide really strong support for residents who are wanting to initiate changes themselves. And as the introduction said, what we've set about doing here is putting in place something which is much more person-centred, strength-based than what we had before. It also, in addition to that, has a much stronger and more explicit focus on addressing inequalities. And were it not for COVID-19, I think that by now we would all have spent some more time looking at this. This is not a report which really focuses on performance first of all. Rather, it's to bring us to inform committee of some of those changes that we've brought into the service. And at this point, I'll hand over to Matt or Lucy. I'm not sure who's going to lead on this now, just to pick out any other salient points from the report before taking questions.
Hi, Jonathan. It's me that's going to be just doing a quick presentation. Just really want to kind of bring out the main points, and I do want to kind of emphasise that it was a successful mobilisation of the service. It was a real shame that just as the launch events were going to be planned and delivered, COVID-19 and the lockdown took hold. I do really want to emphasise the challenges that the service have had. They've had to amend the service during COVID, and again, really want to kind of emphasise that trying to transfer kind of around about 50 odd staff to the new service to develop a new model, a new way of delivery has been very challenging, but they have done really, really well. I know they look forward to developing that team when they can eventually meet face to face. So trying to do that over Teams and Zoom has been extremely challenging. We do have a full service model, and we're starting to kind of see the benefits of that, which is a remote service. We don't know if this has kind of affected uptake, although we have got some kind of anecdotal evidence to suggest that some people are enjoying this mode and fits around their lives. As kind of stated in the introduction, there's a full kind of performance reporting behind this. We have a lot of kind of KPIs and monitoring detail, so we know exactly how the service is performing, and it's great that they've got a full recovery plan. But this plan is really affected by kind of what community assets are going to be out there when we come out of it. But they have developed very strong links, particularly I do want to highlight with the library service. So I know that they're going to be delivering out of the libraries once we get back to full service, and with the district leisure services as well, something that we're really pleased with. Just want to draw your attention to section 8, which is about the My Story assessment. And again, it's something really difficult to kind of explain. I think it's something that you've really got to observe. But the My Story approach was something that we were really, really keen on, and one of the main reasons why they were kind of selected as the successful bidder. But it's not just an assessment about asking people a few questions and gathering information. It's a new way, not just for service users, but also for staff. It's a new way of asking questions, a new way of developing relationships. And it's about understanding clients, their goals. Their goals at the beginning of the consultation might differ then from what they achieve at the end. It's about really understanding the factors that are going to influence their, their quit attempt or their attempt to lose weight. It's really goal orientated, about taking small steps. And one of the key things is for the staff to learn this kind of approach. So it is going to take time, even within normal times. It would have taken time to really embed this approach, and trying to embed this approach, through things like supervision between, people in the service who are more experienced. This takes time, and it's difficult to achieve over Zoom. I'm not sure if I think I'm back. And one of the key aims of the service as well was to try and make multiple attempts. And this is what the My Story conversation can look at. It can really kind of pick out what people want to achieve. So the My Story approach is the key to unlocking this integrated service model. In terms of section 21, which talks about the referrals, we've had really good referral numbers despite COVID, and some of the numbers are outlined in the report. Just want to really kind of highlight some of the things that have never been tried before, such as active case finding, and this involves the service working with GP surgeries and even primary care networks now to kind of search through their records for people who might benefit from their services. So again, this is something new and innovative. They're also piloting a referral system at Bassett Law Hospital for staff as well. So again, this is about generating referral numbers, but also kind of embedding this approach. Just want to draw your attention to something that we're really, really pleased with. Figure 2 on page 5. This is a graph that shows referrals by areas of deprivation. So number 1 on the left-hand side refers to areas of most deprived, going up to 10. And it's really positive because this service is aimed towards, yes, it is a universal service, but we really want this to kind of aim to those people of most need. So it's really positive that in kind of deciles 1, 2, 3 and 4 as well, we've got really high referral numbers. In an ideal world, we want number 1 to be the highest, but this is kind of challenging because it involves really working with communities. And Your Health, Your Way have not had that opportunity to try and really, really get out there in communities. Just want to highlight a couple of bits of the wider work. This is the kind of community aspect of the service, so it's not just about supporting individuals. Just want to highlight a couple of things. During COVID, the service worked with the humanitarian efforts, so they were supplying kind of food recipes in the food boxes that went out. They've developed really strong partnerships with the drug and alcohol service, and also a lot of work that has been done with active knots around that community development. They're also starting some apprenticeship work by recruiting young people to offer them work experience. Again, these things have not been done before. And then there's a few links that we started to develop within adult social care, such as the new maximising independence service, and we're exploring those links and those kind of pathways. And also as well, they're a real kind of keen partner within the new local resilience forum initiative called One Step at a Time, around kind of trying to increase physical activity and improve mental well-being. And again, just want to really emphasise that link with the library service that has developed. So it's a really key partnership. And then finally, ABL, Your Health, Your Way, have got a real strong record in the other areas that they work with on working with elected members. So they are very keen to kind of explore, and it would be good to get your feedback on about inviting members to the service once restrictions are eased, about seeing what the service does, what the service can offer for residents in your area. And also as well, they have a strong track record of hosting events such as around things like smoking, vaping, and child obesity. And again, they would like to kind of extend that invite if you would like to join those meetings or to join the panels. But they would like to hear a little bit more about how they can kind of get involved to develop those local partnerships that have already started to happen, but will get better once the restrictions ease. Thank you very much.
Thank you very much, Matthew and Jonathan. Apologies, everyone. My laptop crashed, but it's now back up and working again. Got the usual bright blue screen with zigzag lines on it, which means it's a reboot. I've got councillors Bosniak and Wise at the moment. So, Councillor Bosniak, Joyce, please.
Yeah, thank you, Chair, and welcome back. And Boyd stood in very well with a little bit of persuasion. Okay, I've got a few questions on this paper. I actually, having read through it, I actually quite like the idea of this key worker, someone who stays with the individual and meeting all of their needs and not focusing on just one. I have been critical of this approach in the past. However, I admit I think this could work very well. In the main, I feel quite positive about it, but I've got a few questions. And that is at section 2 on page 1, Matthew. And that is, it was agreed to pause all weight management with the exception of maternity services, physical activity. I want to know how that decision was reached. Why did you decide to focus on other elements rather than the breadth of the service? So that's question 1. And then I have another question about the many referral pathways. Now we're talking here at 15 on page 3, and you're saying that the pandemic has also impacted on the number of referrals into the service, although it looks as though you're doing very well regardless, with many referral pathways being closed or at limited capacity. Now, I understand that GPs' referral numbers will be lower because people aren't attending, so I just wondered to know whether you could give me an example of what other referral pathways have been affected. And then on figure 1, now I looked at this and tried to make sense of it, because it does look as though your referrals are going up from quarter 1 to quarter 2, but there's no dates around that around those quarters. So just give me a sense of that. I can see when one was reported to council, to this committee, but just give me a sense of referral 1, quarter 1, what does that mean in terms of dates, and for 2 as well, so I can do a proper comparison. And your other figure that you were so pleased with, elected members like to, we have a sense of which are the most deprived areas from 1 to 10, but elected members like to see for instance, is number 1 Mansfield or is it Ashfield? So rather than just little blocks of grey, I'd like to know exactly what areas they refer to. And that's it. Only 4 questions for you, Matthew. I thought I'd be gentle and kind to you this morning.
Thank
Okay.
you, Councillor Bosniak. Matthew, please.
I'll try and address some of those. I wonder if I could just defer the first question to Jonathan, because I wasn't involved in that decision. In terms of examples of referral pathways, yes, one of the main ones is GP referrals, and I don't think that will kind of majorly improve until probably after the vaccination programme. But other ones, it's just those kind of community ones where I'm just trying to think of ones kind of off the top of my head, but things like, you know, referrals from kind of CGL, because they, you know, they're focused on a lot of their kind of that kind of work. Things from like leisure centres as well, we'd get those referrals from there. The main ones probably is from secondary care. So yes, we've got referrals from kind of maternity, but you know, a lot of times it will be kind of people coming in, they'll have the birth and then quickly they'll kind of rush them out. So that kind of time to do that holistic kind of questions and then referrals on has been severely affected. And then also I think there's going to be naturally that change with the transition in service, getting that service brand out there to kind of understand, you know, that the service has now changed, although that has been amended electronically. So there shouldn't be many kind of issues there. In terms of numbers on figure 1, this is very, very tricky to understand, so I'll try and give you some explanation of why. There were a couple of incidences where numbers being transferred over between the service, there was about a gap of probably about a month in transition between the services. So naturally, when ABL would have picked up some of those referrals, people might not have wanted to have those kind of attempts. There was also a couple of examples of secondary care referrals being found as well in an email box that wasn't known about. So these numbers here are very, very high, but the actual quality of those referrals won't be great. So they would have been kind of dumped on ABL as well. So I think it's going to take probably up to about Q3 to really get a sense of those kind of natural referral numbers. So yes, the quality of those referrals in Q1 and potentially Q2 won't be great.
Sorry, Matt, can I just add, Councillor Bosniak, was the dates that Q1 and Q2 relate to?
Yes, it is.
So Q1 is the first 3 months of operation, so that was from the 1st of April to the end of June, and Q2 is the subsequent 3 months following that as well. And as Matt said, yes, they've done a great deal of work to try and drive those referrals up. They're very, very keen. They recognise the fact that some of our referral pathways have been impacted by COVID, as Matt touched on. We don't have as many people coming into secondary care. Our secondary care colleagues are swamped with COVID and perhaps don't have as much opportunity to have those discussions with patients as they access. And so all of that is having an impact on referrers, but they are being very, very proactive. And as Matt mentioned earlier, active case finding to try and drive those numbers up.
Right, thank you, Lucy.
If I just address figure 2 that you kind of mentioned as well, I mean, if it's something that you want, because in decile 1, that will be the most deprived areas from across all of Nottinghamshire. So predominantly there'll be in areas of kind of Bassetlaw, Mansfield and Ashfield, but there will be a number of those spread out across the whole of Nottinghamshire. But that's the 10% most deprived kind of areas across Nottinghamshire.
So
we would be able to perhaps, sorry, Councillor Bosniak, we may be able to get some data from Your Health Your Way, which looks at deprivation by each individual area, if that would be useful going forward, and perhaps provide that to members outside of this meeting.
So are we saying that column 1, is that Mansfield, is it Ashfield, is it Bassetlaw?
It's difficult to say because it's within, I think it's ward levels that there was. Well, it's multiple areas of deprivation within districts. So it's not a district as such. So it would be areas, for example, I know Just thinking in Worksop, it'd be like Worksop South is one of the most deprived areas within Nottinghamshire. So that will be in one of those in column 1. So it's not a district, it's a multiple area deprivation.
Right, okay. Can I just, Chair, can I just ask one question then? Can we have this presented slightly differently then? Because as elected members, we like to see the areas that we represent, and most of us are in the deprived areas, and we like to see whether in reality, the districts, that areas that we represent are getting the services that we feel they need. So something that is more member friendly would be helpful. Thank you.
We can certainly work with Your Health, Your Way to provide that data going forward. And I think that probably links with how we engage with elected members going forward. I know that Your Health, Your Way would be really keen to offer some sort of district level work with elected members and other kind of key organisations within your districts about making sure that their work is aligning with your priorities as well, whether that be in terms of ward or area or your priority focus, or what you think the greatest need is within your individual communities, and they really welcome that opportunity to work with you on that.
Okay, thank you.
Thank you, Councillor Bosniak. Jonathan, is there anything you want to add to that, please?
Well, it was just to pick up Councillor Bosniak's first question, which I think was just to add a bit more explanation around how the decision had been arrived at to pause the weight management and physical activity support. So if we cast our minds back to the spring of 2020, one of the things which came out was a direction from NHS about standing down non-critical services. In addition, we took some measures within the county council to pause things which were deemed to be non-critical in order to, well, two things really. One, to make sure that we didn't have people engaging in non-critical face-to-face activity because of the COVID risk associated with it. But also at that time, it was to free up resource for what in those very early weeks and months, the whole country was wondering would be a massive and overwhelming surge of new cases. And in order to prepare for that, one of the things we did within the organisation and with our commissioned services was to stand down activity that was deemed to be non-critical, to free people up so that they could be redeployed to other things which were more critical. And it was partly as a result of doing that that, for example, we were able to provide additional support to domestic abuse services using people who've been freed up. Now, actually, we didn't, ABL, fairly proactive on this, they didn't cease all activity around weight management and physical activity. I think what's being referred to here is primarily face-to-face activity. And in paragraph 7, it goes on to talk about some of the other things they put in place to provide support to residents wanting to do work on their weight during that time period. Hopefully that makes it more clear, Councillor. Thank you.
Thank you.
Thank you very much. Can I just remind members of the meeting, please, that any comments or questions come via myself as the chairman of this meeting, please. Thank you. I've got Councillor Wise and Councillor Martin. So Councillor Wise first, please, Muriel.
Thank you, Chair. And yes, to thank Matthew for his commentary. I think that brought alive quite a lot of areas of the report, particularly the work that had gone into the transition and now the challenges of making connections. You know, that's understandable. Yes, I mean, I very much support Joyce's point about figure 2. If that could be kind of made a bit more transparent for us. I think for me, and I think towards the end of your comments, at the end of Matthew's comments, the point was being made that connecting with what's going on in our districts is quite difficult at the present time. We'd normally be have more local meetings. I think the thing I would like to know more about is how effective the primary care networks are being in terms of locating people and making the services connect. I was very encouraged by Matthew's comment about the attempts to look at cases, do some case exploration so that folk can be encouraged to come into the services. While COVID is continuing, I'm just wondering how we can get as members get a clearer picture of how the primary care networks are doing in terms of this communication, because the term GP referrals is a bit of a broad description, whether their referrals are coming directly from GPs or whether they're coming through the whole primary care network team. So I know it's a bit of a challenge to kind of gather local information, but just wondering if there's some way in which I don't know whether we could have one or two people from the networks come to adult social care to explain how it's working in their particular patches, or whether
I've got an update on that. If that's okay, I can give you some examples.
Sure. That's the main point I wanted to raise anyway. Thank you.
Yeah. So there's a couple of things. There's a big a kind of discussion debate, I think, within primary cares amongst GPs. Some GPs thinking that it's their responsibility to refer people on, where some GPs think it's the responsibility to just kind of tell people about it and then they make referrals. So we're addressing those kind of issues directly. We're just about to finish a series of meetings with the integrated care partnerships to update them on what we've just kind of updated kind of here. But ABL have taken a really good step approach by taking advantage of particular situations. So, for example, I can't remember the exact one in Ashfield, but there was a really kind of keen GP who was also a clinical director. So they've started to do this active case finding at their GP surgery, and then we're hoping then that's going to expand on. So I think they've got further meetings in the coming months to expand it within that. So I think it's about kind of sharing that success, once they've got success within one primary care network, and expanding that on. But we have kind of agreed to give regular updates to the integrated care partnership to kind of say, yes, we're here, this is what we're doing, and encourage that work with individuals. So again, I think this is something that ABL have done very, very well without having to actually kind of attend those meetings in person, but it's taking advantage of situations as they come up. And unfortunately, ABL have missed out on some of those opportunities because those opportunities aren't there, but they haven't been stood still. They have been actively working at the moment.
Matthew, Councillor Wise, okay with that? Thank you. Councillor Martin, David, please.
Yeah, happy New Year to you all. In paragraph 6, it states that it was agreed to pause all the weight management with the exception of maternity services and increase the in recognition of potential additional risks related to smoking, COVID-19 smoking cessation support was prioritised, like my colleagues have already pointed out. And I do welcome this, and it's clear that during the COVID-19 pandemic, alcohol consumption rocketed across the country. Indeed, according to a survey released by Public England, released in December actually, it found that before the pandemic, 1 in 30 people were drinking more than 50 units a week, which amounts to more than 5 bottles of wine. In March, when coronavirus restrictions were first brought back across the UK, the figure was around 1 in 20. So despite a surge in referrals to change, grow live, they met the challenge brilliantly. I'm pleased that a number of people smoking went down. I packed up 35 years ago. So it went down significantly in response to the impact on their lungs if they caught coronavirus. So more than 1 million people have given up smoking since the COVID pandemic hit, and a survey for Charity Action on Smoking Health suggests of those who quit, 41% said it was in direct response to coronavirus. So it's great news that referrals for smoking cessation went up dramatically, as figure 9 on paragraph 21, page 4 points out. In just one quarter, referrals went up from 1,785 to 2,191. My question is about what was not prioritised, and I want to be as constructive as possible, Mr. Chairman. After all, our healthcare staff have been magnificent, and it's been an unprecedented year. As I've said previously, during the pandemic, mental health issues went through the roof. And according to the NHS Federation, there was more than 30% drop in referrals to mental health services during the pandemic. But there are predictions that the recent rise will mean the demand actually outstrips pre-coronavirus levels, perhaps by as much as 20%. So obviously, especially with the implementation of Tier 3 and then even more in Tier 4, and especially at this time of year, this is the highest suicide rate period of the year now that we're in the middle of. So my question will be, when are we going to bring some of that back online? And the other elephant in the room, of course, is drug abuse. Because during the pandemic, Nottinghamshire saw a 4% increase in opioid prescriptions that was according to the Global Recovery Initiatives Foundation. The misuse of drugs went up too, with police dealing with more issues involving drugs in places like Ashfield and Mansfield. So bearing that in mind, bearing what I've just said, based on the hard facts as they set out, why were mental health and drug abuse not prioritised, and can that change this year?
Okay.
Thank you, Councillor Martin. Matthew, are you doing this one, please?
Yes, I can do. I mean, I do really want to emphasise there's real strong partnership between ABL, Your Health, Your Way, and CGL. It's been very strong kind of partnership, and the element of the integrated wellbeing service around reducing alcohol is a new kind of intervention offered on scale. So I think one of the key things for ABL is that ability to support people who don't quite meet the threshold of CGL, and also they work really strongly. So if there are people who are, say, like stopping smoking, but have got a bit more serious kind of alcohol misuse problem, they can then actively kind of share that case between the two services and work well with each other. So that partnership will really grow and will really strengthen. In terms of mental health is an aspect of the service, but the people won't kind of access the service just for a mental health intervention. It will be part of the holistic intervention around checking up on their mental health and then kind of working with that service unit around strategies. I'm sure Lucy might be able to say a little bit more because she's the lead on mental health. And then finally, with the drug misuse service, the ABL is not commissioned to deliver that. That is the work of CGL, and CGL. I'm sure Jonathan can give an update of being, extremely kind of busy. So yes, it's kind of there's real strong partnerships with other commissioned services is starting to bring kind of benefits as well. And again, with mental health as well, working with the IAPT Insight service as well. So I don't think it's a case of these things being paused. Other services have been doing it, and mental health was not a discrete intervention of this service, but a part of the service offer.
Thank you, Matthew. Jonathan, I noticed you got your hand up. Have you now put that down?
Chair, it was because if there was further comment around our work on mental health, Lucy Jones would be well placed to comment on that if you wish, and then subsequently I can make a brief comment about our investment in drug and alcohol abuse. Perhaps I should do that now, and that's really to thank Councillor Martin for his comments. I think he's right to highlight all of these impacts of COVID-19, but I can say that we haven't deprioritised either work on mental health or on drug and alcohol abuse. Indeed, committee earlier in the year approved some additional investment from public health reserves on both of those agendas. As things stand at the moment, CGL is fully funded for the demand and activity that's coming forward at the moment. But Councillor Martin's would be quite right to to make the point that we need to keep a very close eye on that, and that we don't end up in a situation where CGL finds itself unable to meet all of the demand coming forward, whether that relates to alcohol or to other types of substance misuse. So yeah, I'd thank Councillor Martin for that.
Thank you, Jonathan. Lucy Jones, do you wish anything to add to this?
Yes, thanks for raising mental wellbeing, Councillor Martin. It's a really important point at all times, but especially now, as you note. Just in terms of some of the wider mental health work we're working with our system partners on, we do have a new 24/7 crisis line and a new mental health support line that's provided by, commissioned by the CCG, which we work with our CCG colleagues in actively promoting those. We also, I recognise your point around suicide risk during the current time as well. So we lead on the suicide prevention strategy across Nottingham City and Nottinghamshire County. We've done a lot of work during COVID to reassess and reevaluate our plans based in line with new guidance and have revised those. We've also continued our real-time surveillance work where we monitor suicides on a weekly basis as reported to us by Notts Police and British Transport Police. And as a result of that work, we have done some more intensive communications around older people and also our student population as well around suicide prevention and suicide awareness. And in terms of Your Health, Your Way specifically, as Matt pointed out, it is a core element of their service that they work with their client group to support them in improving their mental well-being. And I think as of last week, they've had over 100,000 contacts with people to date since April. And a lot of that will also involve talking to them about their mental well-being, checking in with them during COVID and lockdown periods as well. And as Matt touched on there, they're working very closely with our health colleagues, so Notts Healthcare Trust, around people with severe mental illness, and also our psychological wellbeing services such as IAPT. And for example, they've just piloting a programme with some Syrian refugees, which also includes insight providers within that, so they can work with that particular population of people to support them, their mental wellbeing with our health colleagues as well. So they are, Your Health, Your Way are very integrated within that wider network of providers to support people's mental wellbeing.
Thank you very much, Lucy. David, okay with that?
If I may just come back, Chair, yeah, I'd like to thank the members of the health, community across the county for the work they're doing. But what I can say is at this time of year, this epidemic has changed the psyche of the nation, not just, and it's a very difficult thing to deal with because it's across the whole spectrum. And if I could just give you an insight into it, I had to take a tenant to look at a new property in December, and I rang around and asked for, because she's an elderly lady, so she's moving on, and the chains broke down, and she really, really needs to move. So we were looking for an appropriate property for her. I rang an estate agent up, and he said to me, I can put you on the list to look at the property, but there are 100 on the list. And I said, why is that? What can you give me an explanation of that? And he said, yeah, we've got people coming back from university, people have gone, come back, divorce rate is rocketing. So all of these things across self-employed sector where they've lost their jobs, people have gone from running minibus companies and now working at a sports direct outlet. The whole psyche of the nation has changed, and it's very, very difficult. So I know I congratulate you on all the good work you're doing, but I think this is going to be a tough year, especially with the added pressure of the new strain of the coronavirus. It's really added a new level to it. Thank you, Chair.
Thank you. There are no more speakers, so I'll hand over to Joe. In order to make the voting clear for each agenda item, I'll ask Joe to read out members' names alphabetically in order for them to confirm whether they're voting for or against the recommendations or whether they're abstaining. Joe, please.
The votes today won't be recorded in the minutes of the meeting unless 2 or more members request it in line with the usual recorded voting procedure, but we'll now follow the roll call vote. Councillor Bosniak.
4.
Councillor Butler.
4.
Councillor Elliott.
4.
Councillor Fielding. 4. Councillor Garner, who's here as substitute today for Councillor Sissons.
Good morning. I've just come late into the meeting. I haven't seen all the debate, so I'll probably have to abstain on it, if you don't mind.
Thank you, Councillor Garner. Councillor Harper.
4.
Councillor Martin.
4.
Councillor Purdue-Horan.
4.
Councillor Vickers.
4.
Councillor Vice.
4.
And Councillor Woodhead.
4.
Thank you, that's carried.
Thank you, Joe. We'll now move on to item 5 on the agenda, which is the Contain Outbreak Management Fund, and you'll find that on pages 15 to 24 in your agenda pack. The Contain Outbreak Management Fund has been allocated to local authorities by government to support the implementation of proactive containment and intervention measures in relation to the COVID-19 outbreak control. The report seeks approval for use of the fund, for which the Nottinghamshire County Council allocation is £6,625,792. The funding plan included within the report, which you'll find at Appendix A, has been developed with the Local Resilience Forum, the LRF, and their partners, and provides a full breakdown of the proposed activities and outcomes that will be supported by the fund, outlining the delivery partner and spend associated with each. Activities supported by the fund can be broadly grouped into local testing, local contact tracing, enforcement and regulation, schools and education, and support for wider vulnerable groups. In addition, the report also seeks approval to establish 2 fixed-term staffing posts to support the delivery of the COVID-19 communication and engagement strategy. These posts will be fully funded through the Contained Outbreak Management Fund. A further report will be brought to committee to clarify the establishment of further posts within Nottinghamshire County Council. So I'll move the following recommendations as set out on page 20 of the agenda pack. 1, that the committee approves the use of the Contain Outbreak Management Fund as per the proposed funding plan, for which Nottinghamshire County Council has been allocated £6,625,792, and that the committee approves the establishment of 2 fixed-term staffing posts to support the delivery of the COVID-19 communication and engagement strategy funded from the Contain Outbreak Management Fund. Do I have a seconder, please?
Happy to second that, Chair.
Thank you. First of all, can I just welcome Councillor Garner in replace of Councillor Sissons. Welcome and welcome to the meeting. I'll bring in the Director of Public Health, Jonathan Gribbin, to introduce the report, please.
Thank you, Chair. And I will just mention a couple of things in addition to the introduction to what you've covered in your introduction, Chair. The report is really about the fund. The fund, of course, is to make sure that a number of different areas of activity related to COVID response are properly resourced. This report isn't intended to provide an update in detail of each of those specific areas of activity, but just to draw your attention back to paragraph 7, which in outline describes what our overall approach to COVID response is. The other thing I'll just mention at this stage in relation to some of the information in paragraphs 13, 14 and 15, in addition to these monies, I should mention that as time goes on and we unfortunately find ourselves in lockdown again, we are continuing to receive funding from government to sustain these activities going forward. So at a future meeting, you'll find the update that we bring back will reflect some higher numbers representing that additional funding. It does mean in the short run, actually, that the contingency budget, the contingency line that we have in this, contains, according to this report, 1.5 million, but I think actually today it's probably slightly higher than that because of monies that we were notified about last week. That's important because it will make sure that we are properly funded to undertake some of the activity that was announced over the weekend in related to the rollout of targeted community testing, which all local authorities across the country now will be pursuing. And I'm pleased to say that as things stand at the moment, we're properly funded to undertake that as well. Chair, that was all I was going to add at this point.
Thank you, Jonathan. I've got 3 speakers at the moment, Councillors Bosniak, Wise and Butler. So Councillor Bosniak, Joyce, please.
Yeah, just a couple then. It's always good, isn't it, to see extra money. So I've got no complaint about receiving extra funding for the vast amount of work that I know we've got to do. But I just wanted just some clarification really on the issue of on page 16 where it first mentions enforcement and regulation. So I wanted an example of what enforcement activities were that we're currently doing or will be doing. It talks about low-level enforcement activities. I know about the track and trace, and I can see logic in us trying to chase up people, but I just don't understand quite what lower-level enforcement activities are and what we can do with that. Even on the yellow pages, it doesn't really make that clear, so that's why I'm asking that particular question. And then, yeah, it does mention contact tracing on the yellow pages, but not the additional what enforcement is. What will the COVID response and contain coordinators be doing? I think that's the kind of clarity that I'm after. What is it they will be doing? Because I think we need to know that so we can let other people know as well. And then lastly, just a question that, just a bit of a query where it says on page 24, well, page 10 of the yellow papers, and from the humanitarian support, it says commissioning a homeless health team. I just want to be sure about that because I'm aware that certainly Mansfield District Council have got homeless health teams. I would suspect that other districts have as well. So are we talking about something brand new, or are we talking about coordinating all of the activity that's currently taking place? And this is some additionality. I want to be sure that we're not duplicating and instead we're using that money, limited as it is, to best effect.
Thank you, Joyce. Director of Public Health, please.
Yeah, thank you, Councillor Bosniak. So in relation to the enforcement and regulation question that you had, much of the activity that takes place is undertaken by district and borough council officers, and their work on this starts very much with education and support and engagement, often with businesses, but in extreme cases involves enforcement as well. And some of those examples you'll be aware of because they've been in the media. There are some aspects of that as well that the county council has been involved with, and I think you'll be aware that we unfortunately ended up in a position where we were required back in the autumn time to take enforcement action in relation to a pub and also some gentlemen's hairdressers. You also asked about, and I've lost the name of the title now, but about some roles that will be located working within community safety partnerships to coordinate some of the work that goes on again down at district and borough level. Forgive me, I've lost track of the label now on the line in the report that you were referring to.
I'll find it. The COVID response and contain coordinators. Yeah. I just wanted to know what that role was.
Yeah, okay. So these are roles which the districts and boroughs have highlighted will assist them in providing proper coordination to COVID response. And I think what I probably need to do is to come back to you with some more information about the specifics of what those roles will be doing, yes, and also where we've got to in terms of implementing and rolling those out. And then thirdly, I think you were asking about the work with homeless. The answer to your question is really in two parts. So there certainly will be some coordination with districts and boroughs where they have teams who are working with homeless people already, for sure. But what we're talking about here is something that is new and additional. In Nottingham City, for some time, there has been an effective homeless health team which on an ongoing basis is properly funded to provide outreach using NHS nurses to people who are homeless or at risk of homelessness. That is not something that we've had in place in a consistent and properly funded way across the county, I regret to say, up until now. Notwithstanding the severity and the seriousness of what this group of people are dealing with, it's one of the positive outcomes of COVID-19 that it shines a fresh light on this, and that with this additional funding, I think we've got an opportunity to put some things in place now which we would wish to see continue, not just through the period of COVID-19 response, but which I think with our NHS partners, we're really determined to find a way to fund for the longer run as well.
Right, fine, thank you.
Thank you, Jonathan. I've got Councillor Wise. Muriel, please.
Thanks, Chair. Actually, I think, Jonathan, you've answered the questions I had through your response to Joyce, because for me it was about the issue about how the posts that you're suggesting, how they link with district posts and existing posts. And I suppose in terms of the county-wide homeless team, that does seem to be a good case. But is the I think the funding is down for something like 140 odd thousand. Is that going to be sufficient for a team, or is it enhancing posts that are already in existence and making them more full-time or whatever? And I think in relation to paragraph 10, section E, the 5th point about supporting and strengthening discharge teams and establishing liaison coordinators. I suppose, like Joyce, I'm a bit concerned about the level of liaison coordination. You know, are we adding a layer of complexity to the work they're asking people to do, or are we sure that this is going to clarify communication and strengthen it rather than give a level of duplication? And I suppose the broad question for me is, are we getting enough money for what we want to do? Because much of it looks very positive, but have you got any concerns about if we're trying to set up this connectedness, have we got enough money to sustain it through this coming year? Thank you.
Thank you, Councillor Wise. Jonathan, please.
I wonder if I could start with the last question first and then work my way back to the others. If I have a concern that related to the funding of public health related interventions, it would be more about the medium and long run rather than about the funding over the next few months, and perhaps that was what was also implicit within your question. So some certainty and clarity for local authorities about the funds that will be available through the public health grant over the long run, not only to provide interventions and arrangements to the level which may have been required prior to COVID-19, but picking up Councillor Martin's point and recognising the enormous impact that COVID-19 is going to have across our communities, and most especially in those that are most disadvantaged. I think that's going to require some sustained funding over the long run. So that would be my concern in the medium and long run. In the short run, the funding that we're receiving currently from government is sufficient, and I believe at the moment more than sufficient to cover what we are currently required to and what we want to undertake in terms of our COVID-19 response. We need to keep an eye on that because, of course, there are additional responsibilities and initiatives being passed down to us fairly frequently for us to pick up, and we need to make sure that the funding remains sufficient. But that's the position at the moment. Councillor Wise, you also asked about some of the work around the liaison that works around the integrated discharge teams, and in particular the links to and from the community hub. I have to say that, and what follows in the following sentence section beyond that still requires more work. That is very much work in progress, and as I mentioned at the outset, there's a few points in this report that touch on things. This report is very much about their funding, and I probably need to come back to you in due course with more information about their status. But I have noted your pertinent comment about let's make sure that we're not adding in complexity, we're not layering in complexity into this, and I'll take that back as well. I think there was there may have been a further question which I apologise I may have missed now, Councillor.
You muted, Muriel.
It was reinforcing something that Joyce had raised, so I'm happy with the responses. Thank you, Chair.
Thank you. I've got Sue Batty, Service Director. Is this in relation to this item, Sue?
Yes, it's just to answer the question about the hospital discharge and the liaison posts. That's based on work that's happened in other local authorities where they followed up people who've been discharged home with no support or with some support, a small short-term piece of support, and they found that if they've had somebody tapping them into all the things that the hub and the prevention might have to offer with a follow-up call, they found that it's reduced readmissions and helped people be more stable at home. So the name, as Jonathan says, the name might change from liaison, but that's the basis, and that's what those workers will be doing. They'll be doing follow-up calls and linking people.
Thank you, Sue. I've got Councillor Butler. Richard, please.
Thank you, Mr. Chairman. Well, I appreciate the fact that I really am a sort of newcomer to this committee, so if I go off slightly to tangent, I'm sure you'll forgive me. But I'd like to pick up actually further to something Muriel said about the communication and engagement side of things of this. I think like the rest of us over the last week or two in particular, I've been receiving a lot of calls from residents, especially our older residents, who have read on the news and heard on the news about the prioritisation of the vaccination for COVID. And the stock reply that I'm giving is the one that appears on our website and also on the CCG website that's linked to it, that people should wait to be invited, written to or contacted by the local health people. I've lost count now of the number of people who said to me, oh, I've not done that. I went to a website called SwiftQ and put my details in, and they've got places available at, in my case, or my area's case, Gamston, and I went and had my jab the other day. Now, I don't know, and this is probably not so much for this committee but I need to raise it somewhere. But if nothing else, if there's anything we can do to ramp up the communication even more, to get the message across as to what people should or shouldn't be doing, because for whatever reason there is still otherwise there's bound to be confusion, because we know only too well we are in exceptional times, and I understand that completely, but still there is something going on here where people are bypassing the system, right? And my initial, when the first people told me this, I said ignore it, it's a scam, because we know there's a lot of scam things going on at the moment, unfortunately. But the more I looked into it, I checked the website, and it turns out this is a real bona fide National Health Service agency called SwiftQ. So anything you can help us on that, because getting genuinely quite a lot of calls and messages about this. Thank you.
Thank you, Richard. Yeah, it is quite prevalent in Rushcliffe as well. We've had a lot of inquiries from people in Rushcliffe, but it's all over the county. Jonathan, please.
Thank you, Councillor. Yes, I can make one or two comments related to that. First of all, in terms of positioning your question in relation to the paper, the report you have focuses primarily on COVID response in terms of everything that needs doing aside from pharmacological interventions like the rollout of the vaccine. But you're right to point out that actually the big story now and the light at the end of the tunnel is the rollout of the vaccine. And of course, how that is rolled out and the communication to residents is really important. I will pick up your question with my colleague Sarah Carter, who will come along to the COVID-19 engagement board this afternoon to address members from the county council and also some leaders from districts and boroughs as well, because I think the question that you've raised is in other people's mind as well. You are right about the advice that it's really essential we continue to give out, which it's that line around, please don't call us, we will call you. The other assurances given in Nottinghamshire are about the pace of the rollout and that they are on trajectory to complete the rollout to people aged over 80 and people working, I think, in health and social care before or by the end of this calendar month. So the pace is growing all the time. They are on a healthy trajectory. To speed things along, the best thing that the rest of us can do is to wait to be called. The more people that press forward, the more difficult it makes it for our NHS colleagues to manage it properly. But I have noted your point more specifically about the apparent availability of this this website, and we'll pick that up with Sarah Carter later on this afternoon. Thank you.
Thank you, Jonathan. Thank you, Mr. Chairman. But it's you can understand the confusion out there because there appear to be mixed messages going on about the order of vaccination. Thank you.
Thank you. If you do want to go to that meeting, Richard, I've got a vacancy if you want to go to it. Joyce Bosniak, please.
Just very quickly, because I didn't know about this, what's it called? Swift queue. What's it called? Yeah, I didn't know anything about that. And no one's contacted me about it, but I would like to know more, because if there is a way that people are able to jump the queue, then everybody should know about it. So whatever you find out, Jonathan, when you speak to, I can't remember who you said, I'd like to know something about that as well. So an email to all of us would be quite useful. Thank you, Chair.
Yeah, thank you for that, Joyce. Jonathan, did you want to come in on that before I bring in Councillor Martin?
Thank you, Chair. I will just make two other really brief comments in regard to the website. I have been assured that last week that no one who is not entitled yet to a vaccine will be granted a place through that website. So I have been given that assurance. The other bit of information I'll feed in is anecdotal, but fairly close to home to me. I'm in touch with a resident who is eligible and well through her 80s, who followed the instructions on the letter given to her to find herself 97th in the queue on the telephone to take up a place. Now, that's notwithstanding the good resourcing that the NHS have put in place of the telephone arrangements. I'm a little concerned that there may be people ahead of her while she was trying to queue who were not eligible. It's not clear to me how many of them may have been eligible or not, but she was put off from staying on the line as a result. And I think it's really important that all of us and residents across the county, notwithstanding our eagerness to make sure that our elderly loved ones are vaccinated as soon as possible, it's really important that we don't press forward ahead of what is our turn, because in overall terms, it slows things up. And at worst case, It even means someone who is more eligible and who's higher risk than you ends up having to wait longer. Thank you.
Thank you. I don't want to spend too much time on this, but I think I've got Councillor Purdue-Horan and Councillor Muriel Wise on this subject. So Councillor Purdue-Horan, please.
Thank you, Mr. Chairman. I'm sorry to labour the point, but I do fully agree with Councillor Butler's point that there does appear to be mixed messages coming out. I've been in extensive private correspondence with an assistant director of the CCG for South Nottinghamshire, and whilst we are pressing the message that people should not, as Jonathan quite rightly describes, pressing forward, that's kind of been undermined by the CCG, where they're sort of saying, well, no, as long as they turn up with their NHS number, we're quite happy to bring them in. So we have to clear up the message to people. My 87-year-old mother is waiting for her letter, and despite the reassurance of this CCG individual, she will not be jumping the queue. She is waiting for a letter, and I would think that age group tend to comply perhaps more than younger age groups, and if they don't have a clear message, the CCG will come to regret undermining the clear message that we were given last week.
Thank you. Councillor Muriel Wise, if it's on this subject, could you try and keep it succinct, please? Because Councillor Martin's still waiting to ask his question.
No, I appreciate that, but I think Jonathan does need to hear how confusing people are. I thought that website was a scam at first, but people are using it. I just wonder who's running that and who's making it legitimate. I have people, I think it's been my busiest part of my caseload the last week or so, has been responding to people. And like Francis, I have reiterated the line that we've been given to take, and people are saying, oh, well, I phoned up and I got an early appointment and it wasn't being used, so I took my mother along and she got the vaccination. People are and some organisations like U3A and so on are sending the copy of that letter that's been sent to folk who are eligible for vaccination. They've circulated that information and people are using it to get a vaccination. So certainly in the Gedling patch, there's a lot of confusion. And I suppose the other aspect of that is that family members who are trying to stick to the guidance are now being under pressure by an elderly relation or other family members as to, well, why aren't you doing this? Why aren't you getting ahead and getting such and such a person a place? You're just losing out because you're towing the line. So I think it's causing quite a lot of distress, and there does need to be a firm. I know Jonathan's been really strong on communication. I think it does need a strong message, because I've tried to argue with people that if they come out of line, the information isn't going to be logged for their second vaccination. It's going to confuse people. But if you're under pressure to get your relative vaccinated, you're just going to go through whichever route's offered to you. So I wonder if the Q web could just be taken down. I don't know who's running it.
Yeah, thank you, Muriel. Jonathan, as you can see, there's a lot of strength of feeling here at this meeting about this subject. So if you could just answer the two questions that you've been posed and send all of the members of this meeting an email on it, that would be brilliant. So over to you, Jonathan.
Well, probably nothing further to add other than to say I've carefully noted the comments. I will pick them up with my my colleague Sarah Carter. As you're aware, this is being led from the NHS. They will be concerned, I know, to hear the points and the concerns that you've raised. So I'll pick it up with her. Thank you.
Yeah, thank you, Jonathan. The meeting this afternoon, is it public? Will it be going out on YouTube for any members watching who may want to listen in on it?
No, there's a brief record of the meeting which is made public subsequently, but it's not a public meeting as this committee is.
Yeah, thank you very much. I'll now bring in Councillor Martin. David, you seem very enthusiastic to show us your phone a few minutes ago.
Yeah,
over to you for your question.
It's there, so that's that. I don't know if you can see it because my camera's a bit. So anyway, the just in relation to that, Jonathan, it's based at the Gribbin building, St Pancras, London. So the company's national. So just in addition to that, I had a couple of residents who knew nothing about it, and then an 88-year-old bloke who went on Facebook, and our local doctor's practice was sharing that information. And he booked and he's had his vaccine already. So there is a mixed message, and I do. And while we're talking about it, I'll speak to the paper now, and we'll move on. I do support the recommendations at the top of this, and I thank Jonathan and the team for the work during the pandemic again. And of course, communications is key, as we've just all been on about. And right at the start of this pandemic, Ashfield District Council identified press and social media communications as absolutely critical. Typical, the battery's about to die. Just plug it in. Sorry about that. You know, that's why you'll see Ashfield District Council and its councillors in the Nottingham Post on numerous occasions, whether that's pushing government safety advice, our safety advice, or telling stories of the armies of volunteers who played a blinder during this pandemic and just carried on working regardless of their own health and safety. And we're lucky in Ashfield that our team has, you know, our communications team puts in good hard work, timely and accurate communications to our residents across the district all the time. And this has never been more important than now, and I wholeheartedly support these posts because they will in fact improve communication across all parts of our county. We were critical of the County Council 7 months ago with communications over the 1 million coronavirus community fund, and these posts will hopefully improve that, so they're very welcome. What shines through in this report is the importance of stakeholders working together across the county, whether that be borough, district, county council, local resilience group, NHS, local resilience forum, and others. And once again, I thank you for the report, because there's been a lot of sweat and blood behind this, and as far as communication goes, too much is not enough. Thank you, Chair.
Thank you. Jonathan, I don't think there was a question in that one, unless you want to say anything.
Just to use Councillor Martin's comments as an opportunity to acknowledge and to thank district and borough colleagues in regard to this point, the comms colleagues in those organisations with whom we work very carefully, and it's that kind of collaboration which I think contributes to the strength of the work of the Local Resilience Forum. Thank you.
Thank you. As we've got no more speakers, I'll now move to the vote. So, Joe, please.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Garner.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Vickers.
For.
Councillor Vice. Councillor Vice.
For.
Sorry, thank you. And Councillor Woodhead.
For.
Thank you. That's carried unanimously, Chairman.
Thank you very much. We'll now move on to item 6 on the agenda, which is the Adult Social Care and Public Health Service Improvement Programme for 2021 to 22, 2023 to 2024, and you'll find this on pages 25 to 44 in your agenda pack. So the report outlines the department's programme of work and investment required for the development of effective and efficient services during 2021-22 to 23-24. The report sets out how the department will further develop existing programmes of work to realise the benefits and introduce new initiatives that will help the department to deliver its priorities, achieve future efficiencies and support service improvement. The report also seeks approval for the investment required to deliver the service improvement programme, including the establishment of posts to deliver the plan. A presentation to explain the service improvement plan further will shortly be shared by Melanie Brooks, the Corporate Director. The recommendations of the report as set out on page 42 of your agenda pack are that the committee, 1, considers the Adult Social Care and Public Health Service Improvement Programme 21-22 to 23-24 and recommends whether any actions are required in relation to the detail in the report. 2, agrees the implementation of the Adult Social Care and Public Health Service Improvement Programme for 21-22 to 23-24, and 3, gives approval for the resources and posts identified. I'll formally move the recommendations. Do I have a seconder, please?
Second.
Thank you. I'll now hand over to the Corporate Director, Melanie Brooks. Please, can you deliver your report?
Thank you, Chair, and good morning, members. I'm going to ask somebody to just share some slides for me. So this report is effectively doing a number of things, because clearly we're coming up now to the first anniversary of when we stood up emergency planning. So we've almost had a year now of working under COVID and emergency planning conditions. Believe it or not, really, it's hard to imagine that, really. So a lot of the usual business that we would have undertaken through the last 12 months, we just simply haven't been able to do. So this report tries to fill that gap. So usually we would have refreshed our social care strategy through co-production with our residents and people that receive care and support. We usually would have had a council plan, and that would have driven our departmental strategy that committee would have approved, and we would have also been looking at our health and wellbeing strategy and what we understand about our population needs through the JSNA, and all of that good work would have driven our departmental priorities. So clearly in the gap of that, we still have to have priorities for the department, and we still have to undertake some budget management. So whilst all of our full activities are not stood up, and this report, although it is quite long, is much, much smaller than the whole breadth of normal activities, what it tries to do is just to position the work that we're going to be focusing on during this interim time until we can do all of that work I just mentioned and have a sense of priority and planning for the department, both for yourselves, for the public and the workforce. So if I can have the next slide, please. Okay. So clearly we have managed to deliver some activity in the last year, and as you know, we report on the departmental strategy through Improvement and Change Committee, and we took a report there last autumn just talking about how the progress we'd made on the Improving Lives programme. So that formally closed in March 2020, and that was the departmental's transformation and change programme, and that set out how we're delivering a balanced budget for the council. The impact of COVID-19, as you all know, has been quite significant, but we have been able to tackle a number of priorities and stood down a number of things in order to do so. So we've kept that focus on these areas. So supporting people to return home from hospital has been crucial with the times of pressure in the system. Enabling people to have support to meet their immediate needs has been an absolute priority of adult social care and through public health as well in terms of our commission services. And you've heard some of that discussion earlier today, so that we've had to prioritise that support. We've made sure that people receiving care are aware of the impact of the pandemic, that they've got contingency plans in place if they receive services or have a PA to support them, that people know how to report abuse in the home, and that we try to coordinate some of the activities around safeguarding to make sure we're making the best of every contact in the community that people will have with those that are vulnerable to abuse and neglect. And that we've also tried to, as you've heard today, understand the impact of COVID on mental health and some of the greater risk that some parts of the community are facing. So that has really been our focus in the last 12 months. We did start to plan for recovery, and committee heard our recovery plan back in the summer of last year, but clearly we had to stand that back down as Nottinghamshire saw its second wave through October and November. And really since October and November, we've had a sustained pressure on our services. So that has meant the public health team's complete focus has been on outbreak management and control. And you've heard from Jonathan today about some of the steps we have in place to manage that. And with adult social care, like I say, it's delivering this priority to support to people. Can I have the next slide, please? So effectively, we haven't had, if you like, a substantial service improvement plan, but we have tried to keep some areas going that we believe is crucial to support our COVID response. So we do have to have some improvement and change in order for us to cope and to grow. The report tries to break things down into 4 areas. So there are a number of pieces of work that committee are very familiar with that will be continuing, but that now, because the Improving Lives portfolio has been stood down, we don't have the coverage, if you like, for investing in those areas. So we mention those areas in the plan. There are some areas that we wish to extend. So through the plan and the report, we'll be highlighting those areas. So the things that have been particularly successful across the department that we want to extend and build going forward. There are also a small number of new areas for service improvement. And like I say, these are very small, and these are things that we think are crucial to see us through this next round of COVID response. And then the report finalises by talking about the headline budget implications of the report. So the areas that we'll be focusing on for next year's budget in adult social care and health. Can I have the next slide, please? So the continuing areas of work fall into 4 key areas. And these, like I say, are crucial to adult social care. And I have to say there is a bit of an adult social care bias through the report, and that it purely reflects the fact that at the moment public health's sole focus is the pandemic, effectively, and maintaining commission services. So that's why there's a bit of a bias here. So technology enabled care, we've presented to committee a number of times about how we can support people with better technology. As technology extends its ability to support people, and we're working in remote ways as we are now, we're here on Teams, there's a constant need to develop that as our approach. So new technology, making sure we're taking the best advantage of it, and making sure that we're building the technology as we can into someone's support package. That's crucial. So that's an area we're going to be investing in the coming years. Shared lives, you've heard about at committee on a number of occasions, and approved a report last year about how we want to increase shared lives carers. That again will be an area we wish to continue to invest in and to grow in the coming years, and to really make sure we're optimising shared lives as an option for people. Housing with support, that is where we're supporting people of working age to live more independently in the community. So in supported accommodation in the main, and outside of residential and placement settings. So that work will continue. That work really stalled last year with COVID at the first part of the year. And then we're working really now on maximising that as we give that lots of investment and lots of effort and energy to realise some of that potential. And I briefly touched on personal assistance earlier, but that remains a priority. So we know that at the moment that people who are most vulnerable to COVID are best supported in their own home and safely. So the use of PAs, I think, is a particularly COVID secure way of providing services. So that will continue to be a priority for us. Can I have the next slide, please? So there are a number of areas of work, 2 in fact, that we think are giving us the most benefit at the moment and we wish to extend. So maximising independent service. This is where we have reablement for older adults and enablement services for working age adults. And we work to make sure that they can live as independently as possible in their own home. The reablement service has been absolutely crucial through the pandemic, and you'll have heard through the meeting today about the extra vulnerabilities that working age adults have and the extra pressures on their life. So this service is absolutely crucial. So we're looking to transfer budget into that service to extend this offer into next year's budget. Strength-based practice is really going to be important as we find different ways of working with people in the pandemic as we sustain these strict social distancing measures. So it's going to be absolutely crucial that we have the right culture in place to enable that to happen. And you've heard before when we presented on the culture change that for strength-based practice for practitioners and owning and driving performance for the work-based culture is absolutely crucial. So we're looking to continue that work and continue working with strategic partners and to invest in those partners through the budget. Can I have the next slide, please? So these are the areas which have a new area of focus. I have to say it's not entirely new. It's more of a, I suppose, a highlighted area of focus. These are things that you're all quite familiar with that we've been doing for some time. So digital is particularly important, as I mentioned, with technology-enabled care. We've now really been majoring on using remote working, whether that's video conferencing for practitioners, using Teams for our office-based working and working with partners. That now is quite a core part of what we do. So we're going to need to continue to invest in this, and particularly enabling people to access our services will be crucial. We are now expecting the Mental Health Act reforms to be published this week if government work to timetable, and that will have some new burdens and changes for our mental health services, particularly our AMP service. So we are expecting that to be happening through January. Liberty protection safeguards has been delayed until March next year, but we do know we have 12 months of preparation time ahead of that legislation to prepare. So that will be very much part of the plan. Some of these things are very processy about the way that the department works, so performance quality assurance, departmental operating model. We launched our new workforce model last year. We're now going to continue to make sure that we're performing to the best that we can through those new operating structures. Prevention and early intervention is going to be particularly important. Improvement and change subcommittee approved a new council-wide approach to prevention, and certainly from an adult social care perspective, it's particularly important that we have in place a really robust strategy to make sure we're doing all that we can in the community to avoid people needing to receive institutional care effectively. And if they do receive institutional care, that care really works to enable people to live independently. So that's going to be particularly important going forward. And at some point, I'm really optimistic that we'll be recovering and resetting from COVID. So clearly that will be on our agenda at some point going forward. Can I have the next slide, please? So budget planning. In the paper, I'm just checking the page, there is a summary of the impact of this report. So the key budget changes we expect to happen. What we're trying to tackle here is investing in the areas that we know will help us with our increased demand pressures. So we are expecting to see more and more people requiring support in the coming 12 months, mainly because of the impact of COVID. We also, as a department, have experienced a loss of income because of COVID, and there's some financial risk in the social care market because of the measures of infection control that providers have to have in place, and there's some uncertainty about how that's going to be funded into the medium term. So this budget works hard, the proposals here works hard to try and balance that for the adults department, so we have a balanced budget for next year. And it's just to note, we still don't have a long-term financial settlement either for local authorities or for adult social care. So hopefully that gives you a bit of a run through of the report, but happy to take any questions.
Thank you, Corporate Director. That was a very comprehensive report and shows a lot of hard work that's gone into that. And as a department as a whole, all the hard work that's gone in from everyone in all quarters, particularly recognised at the last meeting when we had the awards ceremony. So thank you very much. Any questions or comments from members, please? I've got Councillor Wise and Councillor Vickers. So Councillor Wise, Muriel, please.
Thank you, Chair. Yes, thank you, Melanie, for a really positive and encouraging report. I know it's high level, but it's, yeah, a very positive piece of planning. Just two questions. One very broad. Way back in the 80s, when I was an officer of the local authority, I did quite a lot of training on the strengths-based approach to social work assessments. Do you have a view of why it's still a struggle to get that concept established in the way we view people when we assess them for services? And the other question is really just the financial one. I think you've described well the challenges financially. Have you got any particular concerns about the investment in the services that you plan to provide, as you know, as we come close to the budget decisions? Thank you.
Thank you, Muriel. Corporate Director, please.
Thank you, Muriel. So firstly, the strengths-based practice, I think that it's a constantly evolving picture as society's expectations and people's expectations change and shift. So I think what we would have thought of as good practice 20, 30 years ago, even 5 years ago, I think we're constantly revising. So I think part of it is a bit of a struggle to make sure people stay on track. They feel that they've got the capacity within, you know, the wealth of organisational process and bureaucracy to work positively. So I think there is a bit about making sure practitioners feel they've got that space is part of the struggle. But I also think it's because of the fact that practice evolves and changes, and you know, we have much more of a focus now on reablement, employment, enabling people to enjoy a good life rather than looking after. Particularly, you know, I can think back to how things have changed since I first started to practice. We used to do a lot of things for people, for example. So I think it's the both movements as to why we need to constantly invest in this. But I also do think that the care management system and us moving away from the Community Care Act into the Care Act, I think is still a work in practice. So I think we still have a way to go to move away from looking at assessment as a process and about taking somebody through a commissioning process to much more about how we understand their strengths and build on that to enable them to have a good life. And if they're of working age, the potential to learn, to grow and hopefully to work. So happy to, you know, answer some supplementaries, but hope that covers that bit. In terms of the investments, I think I'm confident in the posts that we have listed here that they're the right ones to help us on our service improvement journey. But I think I still have concern about the stability of the social care market going forward. So we have seen over the Christmas period a number of pressures in our providers, some of them meaning that we're having to close services at very short notice. So COVID's had a significant impact on both service quality issues, but also workforce availability. So I think that will be one of the key risks to this, which is slightly outside of the scope of the paper, I'm aware, but I think that will be one of our key risks and issues going forward. But I am confident in the proposals on paragraph 26 on page 17, that will enable us with enough capacity to start thinking about improving our service offer in the areas we've mentioned.
Thank you. I've now got Councillor Vickers. Steve, please.
Thank you, Chairman. Thank you for that comprehensive report, Melanie. I think regarding the additional isolation, bearing in mind we do have residents in Nottinghamshire that are in isolated areas, and the lack of the face-to-face opportunities that they would also have, as well as others who would normally not have any problems with face-to-face opportunity. What communication mechanisms and contact processes do we have now under this current regime that we are inflicted with?
Corporate Director, please.
Yep. Thank you, Councillor Vickers. So we are still maintaining face-to-face contact with people where we believe it's essential. So if we believe somebody's at risk or their communications are so significant that we're not able to interact in other ways, we are visiting, but our face-to-face activity has reduced. So we are doing much more work now via telephone, and we're using video where we can to communicate with people. And we're also acutely aware that a number of services around a person has gone remote. So that might be about their primary care or their mental health service. So there has been this big shift to that loss of interaction. So the digital inclusion for us is a big piece of this. And I think I've got Grace Natoli also on the call. Grace, are you available to just give a brief update of where we are with our work to enable digital devices and connectivity to people where that's a barrier to them accessing services?
Yes, absolutely. Good morning, councillors. So we've been doing some work based on kind of your question, really, Councillor Vickers, acknowledging that because of the way things are, people will have to follow the guidelines for much longer than we had anticipated. So what we've been looking at is to look at different ways of how we can communicate and engage with people. And one of the initiatives that we are in train with is to procure some devices to either lend or gift to people in exactly the sort of the area that you just highlighted. At the moment, we're at the stage where we're looking at different options on how we ensure that people can get the best out of that kind of digital offer, really. So working with the with the operational teams, working with procurement in terms of ensuring that the devices are fit for purpose, but also with legal to make sure that people, we've taken everything into account to make sure that people feel protected and that they're not taken advantage of. So there's a lot of work going on in the background, and the intention really is to kind of bring back that piece of work for you to kind of have a look at. In relation to the core production, to make sure that the sort of the suitability of those devices, we're working with people, experts by experience, as it were, to test out a couple. I think there's about three of the devices to make sure that it kind of suits the requirement for people. But also internally, we're using some of those devices to test out with people that may be seeking employment, for example, people with, you know, supporting people to be able to be employment ready, for example. So quite happy to bring a detailed piece of work in relation to that. But I think it's an important point you make, and we're aware that certainly digital exclusion can impede people from getting the relevant services that they may be needing, as it were.
Thank you, Grace. Corporate Director, is that it?
Yeah, no other comments in relation to Councillor Vickers' question, unless there's anything, Steve, I haven't covered off.
Yeah, so I've just thrown up a supplemental, I'm afraid. What sort of devices are we talking about here? And are we looking at the elderly and infirm, and those who are unable to use certain devices is also clearly a problem? And how is that going to be addressed?
Yeah, so in terms of the devices, I can't remember the exact model of the device, but like I said, I think it's really important to make sure that we involve people that would use those devices. In relation to a referral for somebody to be able to access that device, it will be very much dependent on the frontline workers, really, to make those referrals, because they're the ones working with people and understand what people's needs are and discuss with them as part of their support planning process. So, you know, we're not taking the approach where we'll just kind of hand them out. It will be very much be recommended and referred by the frontline staff as part of somebody's support plan to help them achieve their outcomes. In relation to the support, part of the procurement piece, which has actually been advertised and is out at the moment, is to team up with a strategic partner who can help people, like almost like a help desk, if you like, that people can tap into either through their family or themselves, or with the help of the of a worker, somebody, a social care worker who may be working with them, to make sure that people get the best out of that device, rather than be just kind of left with them to work it through, really. So this is quite new. Other local authorities, I think we've been learning from other local authorities like Leeds, who have been ahead of the game, and you know, it's something that hasn't been done before. So we're sort of learning and making sure that we put the right processes in place to make sure that people feel supported, either digitally. I don't know if that answers your question, Councillor.
No, that's fine. Thank you. Thank you, Chairman.
Thank you. I've now got Councillor Elliott. Boyd, please.
Thank you, Chairman. Some great work going on there. Thanks, Grace. That was a great answer there. This is maybe for Melanie. It's about the 3 conversations model, and if you could expand on the model a bit more and see how it's going to impact on this council. Okay.
Thank you, Boyd. So 3 conversations is about practitioners spending much more time with people and trying to work through them, their particular goals, and have in place support, working intensively if that's needed to get that support in place, rather than automatically working through an assessment. I think I have Ainsley on the call, who can give some examples from Living Well about how practically we would see 3 conversations changing from what we're doing now to a new way of working. Would that be okay, Ainsley, to give an example?
Yeah. So I think the changing in how we'll work with people, I think we've quite often had quite almost a paternalistic relationship that's evolved with people. So the focus now is very much on actually having a different conversation, not just with the individual, but also with their family, who, you know, are very influential in decisions that are made. And you know, people are starting to do that and are starting to you know, have the conversations with the individual about what they want to do, what they're able to do for themselves, as opposed to us always providing the answer, which I think often it can be quicker and easier to do that, but that's not the ethos that we want people to work with in. We have had some, you know, sort of good examples where people have worked in that way, where perhaps you know, decisions have been made around where someone wants to live, which may not be in line with what, you know, parents necessarily think, or indeed with, you know, what we as professionals think, but it's how you support that people to give them the opportunity to at least try something out, and then, you know, if that doesn't work, then we can go back in and review and revise the package of support around that individual. So it's a different mindset. It's not about us as professionals providing all of the answers. It's about actually engaging with that individual to help them to find their own solutions, and help them to you know, sort of try out things by themselves, as opposed to always looking for a response that involves paid support, or you know, a support mechanism that we would normally turn to. I can see Councillor Purdue-Horton, you had your hand up. I don't know if you want to ask me specifically a question.
Can we just deal with this question from Councillor Elliott first, please?
Yep.
Councillor Elliott, is that okay?
Yeah.
Thank you.
Yeah.
Thank you. Councillor Martin, David, please.
Yeah, thank you, Chairman. I do welcome this report. It's like a forensic analysis of what went well and things that needed to change, and you can clearly see that the pattern is being followed, and they are readjusting as they evolve. I'd argue that a lot of the problems are not caused by the county council, and they're caused by the government, really. You know, I mean, some of the releasing people from early on in the pandemic, when they released people from the hospitals on a very fast pace, they accelerated the release process and sent them into palliative care, into care homes, without giving them coronavirus tests, was truly the wrong thing to do, because it's a different virus, and I don't think it was completely understood at the time what impact it would have by taking that move just to clear beds in hospitals. And a recent survey by the BBC claimed that that decision to move NHS patients without adequate testing has cost around 15,000 lives of the most vulnerable people across the country. So what support in terms of PPE did the county council get from the government from day one? That's one of my questions. In 19B, item 19B, the top of page 13 of the report, it talks about gap analysis for the community-based asset planning that's taking place to establish what is currently available and where the gaps are, and the IT that you've just been talking about is part of that. And most large supermarket chains do tech buddy services, and that's what you really need to be looking at, a tech buddy service to help people use the new technology in isolated areas, because that's what we're really up against. So can I ask how that gap analysis is going, and if it involves members and community groups? On page 16, paragraph 25, in the financial implications, it says the extra staffing costs will be 1,978,673, and it states that the extra cost will consist of internal staffing posts and the costs external to adult social care and public health departments. So what are the external costs? Finally, on reflection, looking back on a tough year, would we be facing these extra costs if it wasn't for COVID, or are these all brought about specifically by the pandemic?
Thank you, Councillor Martin. Corporate Director, please.
Okay, so firstly, the PPE question. So I haven't got in front of me the exact timeline for PPE and when the government portal came online. I believe it was sometime in September, but I can check that out and clarify. But up until the point at which social care could order PPE through the portal, which the government set up, we were relying on either the PPE that we'd procured ourselves or from the LRF PPE drops that were given to LRFs for the PPE. And as a county council, we did have adequate PPE for all our staff at that time, and we did have mutual aid arrangements in for the market. So there were times when nationally PPE was in particular full. In terms of the bit about the tech buddies, I think in the presentation that Grace gave in answer to Councillor Vickers' question, she covered off that process. So we were procuring a partner to help with that tech buddying. That's what we mean by support, is somebody to enable someone to get the access. And as Grace has outlined, we're doing some of that testing with people ourselves through co-production. And then Councillor Martin, sorry, I can't find can you tell me which page that comment is on in the report so I can answer the question fully, because I couldn't see the comment.
What page, which one?
This, oh, okay, no, I found it. Okay, so paragraph 25. These consist of internal and cost external to the social care department. Yeah, so the cost that's external to the department is the Partners for Change. So on page 17, there's a table of costs, and that cost that's external to us is the Partners for Change temporary 100,000. So that's the organisation that support local authorities in rolling out 3 conversations.
Right.
Thank you. I've now got Councillor Purdue, Horan, Francis, please.
Thank you, Mr. Chairman. The recommendation asks us to approve the establishment of 5 temporary full-time equivalent posts and 49 full-time equivalent permanent posts. And within those 49, we have 32 full-time equivalent for senior reablement workers, and in addition to that, 3 full-time permanent managers. That's a significant recruitment. What impact are we expecting from such a positive recruitment exercise?
Thank you, Councillor. Sorry, Chair. I've spoke too soon. So,
That's all right.
Thank you, Councillor. Yes, we're really expecting that those workers to help with enabling people in the community to get good access to reablement support. So with the priorities in the hospital discharge pathway, we haven't been able to have the capacity to give the services we want. But Sue Batty's here on the call, so I suggest that Sue just summarises that the numbers that we'd expect those staff to enable to support and some of the outcomes we're hoping to achieve for some of our residents. That would be really helpful, Sue.
Yes, I'm happy to do that. So if you recall, just before COVID hit, we had our partners Newton doing some diagnostic with us again, and this started this assessment, and there's about 600 and there's anywhere between 630 to 800 people living in the community who could benefit from reablement, who are getting or have just got home care. What's happened is we've expanded our reablement service. We've worked with our partners on hospital discharge, and we're now doing really well getting more and more people directly home from hospital rather than them having to go into a bed. So a lot of our resources have been directed that way. So the additional people that we can work with in the community, that will obviously be really beneficial because those people will be helped to be more independent, and will also be freeing up much needed home care capacity for the market, and obviously in the long term it will save our finances as well if we are getting people back to independence rather than continuing to support them. The makeup of the service, because obviously we've got a lot of frontline workers out there, it's tried and tested. We've reviewed it with Newton, and the way that we structure the management and the service has been reviewed with them, and they're supportive of it, and obviously it works well at the moment, so we've used the same breakdown of staffing.
Thank you, Sue. Councillor Purdue-Horan, thank you. We've now got no more speakers, so I'll take it to the vote. Joe, please.
Chair.
Yeah, you've already had your say, Councillor Martin.
Yeah, and there was one question that wasn't answered. Could you tell
sorry,
me,
go on. Yeah.
Sorry,
yeah.
Thank you. Could you tell me what proportion of these costs are entirely attributable to COVID and what are just ordinary costs?
Thank you. Corporate Director.
All of these costs are ordinary costs. They're part of the mainstream budget planning. They're not part of emergency planning.
Right. Thank you, Chair. Thank you very much.
Thank you. We'll now move to the vote. Joe, please.
Thank you, Chairman. Councillor Bosniak.
4.
Councillor Butler.
4.
Councillor Elliott. Councillor Elliott.
4.
Thank you. Councillor Fielding.
4.
Councillor Garner.
4.
Councillor Harper.
4.
Councillor Martin.
4.
Councillor Purdue-Horan.
4.
Councillor Vickers.
4.
Councillor Vice.
4.
Councillor Woodhead.
4.
Thank you. That's carried unanimously.
Thank you, Joe. We'll move on to item 7, which is update on progress of the procurement of a new framework agreement for equipment-based major adaptations in people's homes. And you can find this on pages 45 to 48 in your pack. This report is to update the committee on progress with the procurement of a single provider framework agreement for equipment-based major adaptation solutions, which was approved by the committee in December 2019. This is a Nottinghamshire-wide service for people of all ages, including children, that will ensure that the equipment-based major adaptation solutions are installed cost-effectively, quickly, and with minimum disruption to people. A framework agreement for stair lifts has been established by the County Council, and the district councils can utilise this contract as public bodies using the Disabled Facilities Grant on behalf of the individual in need. The recommendation as set out on page 48 of the agenda pack is that the committee considers whether there are any further actions it requires arising from the information contained in the report. I'll formally move the recommendation. Do I have a seconder, please? Councillor Elliott. Thank you. We've now got Kate Bennett, Principal Occupational Therapist, to introduce the report, please. Thank you.
Thank you, Councillor Harper. So really this, I'm hoping, is a bit of a good news story for the committee members. As Councillor Harper said in his introduction, the committee approved this procurement, the tendering and award of a single provider framework in December last year. Because of COVID, the timescales were pushed back, and it's only really now that I can report that we have successfully procured that contract. So we did some soft market testing in January 20 because originally we were looking at a whole range of equipment-based solutions that are funded by the Disabled Facilities Grant, things like vertical lifts, modular ramps, wash-dry toilets, this kind of thing. When we did the soft market testing, we realised that because we have manufacturers and suppliers who would want to bid to get the best deal, really, for the people of Nottinghamshire, we should focus on stair lifts. That was the piece of equipment that we purchased most often, the district councils purchased most often with the Disabled Facilities Grant. The evaluation, the tender evaluation happened in the summer. Stana were the successful bidder, and the OJEU award notice was published in October 20. We got an incredibly good deal, both on price and quality, and I'm very pleased with the process. So the county will manage the framework agreement. All of the 7 districts can choose whether they want to use the framework or not. It's up to them, and that includes Nottingham City. And what it means is that we'll have a consistent approach across the county. We can take advantage of a recycled stairlift scheme, which is better for the environment, and it means that there's more money in the Disabled Facilities Grant available for other adaptations. The savings that we predict are more than we thought because of the pricing schedule that the award has achieved, and the benefit of doing this, particularly during the pandemic, is that there'll be less footfall through the person's home. Traditionally, we would have had to have had 2 representatives from stairlift companies going through the person's house to quote for procurement reasons. So we've eliminated that footfall, which is a positive during the pandemic, and it also simplifies the process for the occupational therapist, meaning they can spend more time doing their occupational therapy interventions and not having to do the administration and paperwork type exercises. There's no recommendations or approvals from this form other than I think to see how this procurement pans out, and if it is successful we can perhaps extend it to other pieces of equipment as we planned originally. Are there any questions?
Thank you very much, Kate. Could I remind members that we are running short of time, so if we do want to do the other items justice, so if you could be concise, please. So I've got Councillor Martin David, please.
Yeah, I think it's a very uplifting agenda item.
Okay.
And I think it's a very good idea, I really do, because, you know, I've had residents who have had lifts and stair lifts and they've been trapped downstairs through malfunction or trapped upstairs for a week at a time. the strength in numbers that this contract will hopefully bring, and the benefits, obviously financially and positive as well. So the strength in numbers, rolling it out across the county, hopefully will help that process. And like you've just alluded to, the longevity of the process has been shortened because you've only got one contractor going in. So I'm for it. I definitely am. So thank you for that. Cheers.
Thank you.
Thank you. Councillor Wise, Muriel, please.
Thank you, Chair. Yes, it seems a good step forward. The main complaints I've had from residents in relation to stair lifts, with Stan, as with some others, has been about the insurance and what the insurance covers, and in terms of repairs and replacements. I think sometimes it's been about the arrangements not being very transparent, and I wondered if that's going to be improved if we have the contract with one provider. And I suppose linked with that, will there be some sort of quality assurance process for ensuring that since we are committing ourselves to one provider, that they do continue to provide well? But it's the insurance issue mainly. Thank you.
Thank you, Muriel. Kate, please.
Yes, Councillor Wise, I can answer both of those questions. So first of all, the insurance, the warranty is, we have a 5-year warranty package that is included with the stairlift purchase. So that's been quoted on the pricing schedule as part of the contract. When we're using recycled stairlifts, we only recycle stairlifts that are less than 5 years old, and then we add on the warranty package, so people are always getting a product that is well maintained, and that's why the quality is so important with this kind of scheme. And then going on to the monitoring the contract, the key performance indicators, and monitoring the quality of the product going in and the process of delivery. County will manage that contract management. That's bedded into the contract, that, you know, the pricing schedule. There was a 1% that allowed us to do that on behalf of the district, so we can have that oversight, because I think that's really important when you're dealing with recycled products. You've got to have quality products going in. So yes, that's all covered off in the single framework.
Thank you.
So
okay
just,
with that?
No,
Go on, Muriel.
Just one further question. So say when the 5-year warranties come to an end, or if they are using second-hand stairlift, will there be some clarity about who they go to for repairs? I think, you know, we're talking usually about quite frail, particularly with older people, quite frail people who might not track when the end of the contracts come to an end. Is there some sort of communication that can be put into place to explain to people what the options are after 5 years? Thank you.
Thank you, Kate.
Yes, Councillor Wise. We have a letter that we send out to people that explains the warranty and the implications. I absolutely agree with you. It's a very common problem that people don't process that information necessarily, or the relatives don't, and we do get inquiries all the time about you know, who's going to maintain my stairlift after the warranty period. It is the person's responsibility after that 5 years, but we do support people through that process.
Thank you. We've got no more speakers, so we'll move to the vote. Joe, please.
We can't hear you clearly, Joe. So we can't hear you very well at all.
Apologies. I'll try and speak louder and more clearly, and hope that you can hear something. Councillor Bosniak.
Yes, support the paper.
Councillor Butler.
Yes, happy to support.
Councillor Elliott.
Yes, happy to support.
Councillor Fielding.
Happy to support.
Councillor Garner.
Happy to
4.
Councillor Harper,
4.
Councillor Martin,
4.
Councillor Purdue-Horan,
4.
Councillor Vickers,
4.
Councillor Vice,
4.
Councillor Woodhead.
4.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move on to item 8 on the agenda, which you'll find on pages 49 to 54 in your agenda pack, and it's temporary posts to complete deferred assessments of care packages funded in the short term by the NHS during the COVID-19 pandemic. So this report seeks approval to establish temporary posts to complete deferred assessments of care packages that were initially funded by the NHS during the first wave of the COVID-19 pandemic from the 19th of March to the 31st of August. Across Nottingham and Nottinghamshire, 1,725 people received support using £15.7 million of the NHS fund. 1,200 of this total were people living in Nottinghamshire. The Department of Health and Social Care and Adult Social Care Winter Plan requires all authorities to secure enough staff to rapidly complete deferred assessments. The allocation of national funding to the Nottingham and Nottinghamshire Clinical Commissioning Group is 1.126 million. 390,000 of this amount has been allocated to the council to cover the cost of the recruitment of staff and equipment to carry out the council's responsibility within the joint plan. Due to the very short timescales available to undertake the work, part of the council's share of this funding has already been used to recruit temporary staff and engage agency staff up to 31st of March 2021. I'll now move the recommendations as set out on page 53 of the agenda pack, that the committee approves the establishment of the following post and equipment budget, which will be funded from the £390,000 funding allotted to Nottinghamshire County Council as part of the joint deferred assessment plan agreed with Nottinghamshire Clinical Commissioning Group, CCG, and Nottingham City Council. Further to the temporary establishment of some posts, the extension of the following 7.2 full-time equivalent temporary community care officer grade 5 posts until the 31st of March 2021. And B, the extension of 2 full-time equivalent temporary social care assistant grade 3 posts until the 31st of March 2021. The establishment of 6.2 full-time equivalent temporary community care officer grade 5 posts until the 31st of March 2021. The establishment of 9 full-time equivalent temporary community care officer grade 5 posts until 30th of April 2021, an equipment budget of £143,000. I've moved the recommendations. Do I have a seconder, please? Thank you. Service Director Sue Batty, could you please introduce the report?
Yes, thank you. I think I'll just give a bit of an update really, because the main points have been covered in the introduction. So for Nottinghamshire, we had about 1,200 people on our list who needed their eligibility for how their support would be funded, and we've worked through quite a lot of people whose arrangements were quite easily resolved, and we've now got 449 people to work with to the end of March, and quite a number of those people are people that were doing multidisciplinary assessments with health because they might be eligible for some continuing healthcare funding. So we have got a number of staff. We've had a number of us. We've been recruiting since November into this team, and the list that you'll see on the report is a mixture of extension and new to those, so that we can finish the work with the remaining people. And we're also making sure that we understand and are getting information out to people who might be self-funders on that list, because clearly that those are people who've been waiting for a little while to know how their care will be funded. So we're making sure that we're prioritising, clarifying that for people. I'm happy to take any questions.
Thank you, Sue. I've got Councillor Wise. Muriel, please.
Thank you, Chair. So I'm sorry if I'm being a bit obtuse about this, but does this mean that there won't be separate health staff carrying out the continuing healthcare assessments anymore. Our social work, local authority staff will be doing the assessment on behalf of both health and social care.
No, it doesn't. No, what this is this is a sort of a one-off piece of work of people who their eligibility assessments were suspended. Some people are eligible for potentially for continuing healthcare, some not. But we've got to review everybody. And health was allocated a share of the national funding as well.
Yeah.
So they spent £600,000. They brought in an agency of nurses to do their element of the continuing healthcare assessment. So we're working really closely with those staff in that agency to align, because obviously it needs a health perspective and a social care perspective to undertake the CHC assessments. Because a lot of them are joint. So for the continuing healthcare, health will do a lot of it, but social care are involved to make sure that it's a holistic assessment and issues aren't missed.
Yeah, if I could just, so in terms of people coming forward for new assessments, will they be carried out as they have been in the past?
Yeah, so new assessments are separate to this, and that continues as it has done in the past. The only difference to that is that's continuing healthcare assessments, none are being done in hospital now, so it's all after the person has been discharged home to assess, and health fund the support until that work's completed.
Because certainly from the few cases I've been involved in over the last few months, it's still quite a nightmare for families getting a decision about what funding is going to be available, particularly if it's a joint social care and health package. Whether it's a shortage of resources in our finance team, or whether it's a shortage of resources on the health side. But you know, I've sat in one or two meetings with health, going through the paperwork with very articulate family members who've filled in the very thorough assessments that have to be done, and it's very frightening still, and it does seem to take an enormous length of time before people get a decision about what funding is available, and particularly if they're needing overnight care for somebody, you know, so much money is going out of their own resources before they get a decision.
Yes, I think it's a bit of a joint issue, to be honest. So we've got this across health and social care. So during the pandemic, the nurses that normally do continuing health care assessments were redeployed. So we've got this backlog of 1,200 people to work through, and we've got all the new people coming through. But certainly it should be a maximum of 6 weeks for the continuing healthcare assessment for new people. But it is a bit of a balance, because obviously the first thing we want to offer people is a period of reablement and rehab. So it's important that we do that assessment when they've had that. But I'm happy to talk to you if you've got people, councillor-wise, that you want to check back with our service if they're having lengthy waits, then we can do that. I think you're on mute.
I don't have any currently, Sue. They got sorted, and and the decisions were positive. It's just the time.
Yeah, we have got a number. Hopefully from April we'll be back to new people, and the system will start to flow more smoothly then.
Thank you. I've got Councillor Martin David, please.
Yeah, thank you, Chair. As I mentioned earlier, I think the policy to discharge patients into care homes on the 19th of March was obviously disastrous. But the result of the decision wasn't the council's fault. The decision to scrap the COVID-19 hospital discharge on March the 31st is a kick in the teeth to, it's an insult to every member of staff and this authority who's fought valiantly during this pandemic, you know. And I'll vote for it today, Mr. Chairman, but only because it's essential. And we're back to that same old question again, aren't we? of the green paper being cancelled 6 times, you know, and the white paper, because until we get proper funding and a structure and strategy going forward, we're never going to get this. And the small olive branch that they held out in March 2020 is now being taken away, with the bill being picked up by Nottingham and Nottinghamshire's CCGs. And that money could have been spent on other priorities, Mr. Chairman. So can I ask, how many of the current employees do we expect to see their contracts extended, and will this result in job losses?
Thank you. And as numerous times, Councillor Martin, there's nobody on this call that would disagree with your comments. Sue Batty, please.
So you'll have seen on the previous transformation report in terms of what happens to staff. So we've got some people, we've got a mixture of people on temporary contracts that are being employed to do this work, temporary council contract. We've got agency staff, and we've also got people that come through our supply register. And we have wrapped a strategy around this. So you'll remember the transformation report, which had a number of community care officers. This report has a number of community care officers. As the temporary posts for this piece of work end, where people are wanting to carry on working for the council, we'll be moving them. We'll be able to look at whether they could pick up the start posts. They'll be able to apply for those. So we are making sure that anybody that comes in on a temporary basis has other opportunities. It's keeping our staff and filling vacancies is an ongoing issue. So we are looking to, wherever we've got good people who want to continue working with the council, we're making sure they're aware of all the permanent posts and tying that up. But this is a one-off piece of work. Once we've worked through the 1,200 people, we'll be back to business as usual, and we'll sort of use our steady state workforce staffing for that.
Thank you. I can't see Councillor Martin. I assume that's answered your question. The next speaker I've got is Councillor Purdue-Horan. Francis, please.
Thank you, Mr. Chairman. And I quite agree with your comment to Councillor Martin. He certainly isn't the only person who is frustrated by the situation. I was listening to one of my colleagues, the MP for Bassetlaw, yesterday on Times Radio when I went to get my paper. Who was being interviewed by Gloria De Piero and Tom Newton-Dunn. And he said the same thing, that you know, the whole COVID situation has blown promises and plans off course and delayed, and we are where we are. And you know, we're not the only ones frustrated. So it's good to at least to be assured from time to time that, you know, others higher up are equally keen to try and get back to some normality, so we can progress with what is promised and planned for.
Thank you, Councillor Purdue-Horan. Joe, there are no more speakers. Could we go to the vote, please?
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Garner.
For.
Councillor Harper. Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Vickers.
For.
Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move to item 9 on the agenda, which is the National Children and Adult Services Conference, November 2020. And you'll find it on pages 56 to 58 of your agenda pack. The report informs the committee of the key messages from the National Children and Adult Services Conference, which took place online from the 4th to the 6th of November 2020. As a consequence of the national restrictions on meetings and travel, the conference was held via Zoom. A range of issues and priorities in our adult social care services were reflected in the conference agenda, including the identified and anticipated impacts of COVID-19 on service provision. Other major topics topics covered were equality and diversity, housing, funding issues and mental health, and the report includes some key learning points identified from the department. The recommendation is set out on page 58 of the agenda pack is that the committee considers whether there are any further actions it requires in relation to the feedback from the National Children and Adult Services Conference contained in the report. I tried to get to as many as I could of these sections, but to me it wasn't the same with it being online. What I missed was the networking, which I find really useful when you actually go in person to these conferences, and I did find it a bit too front loaded. I know it's difficult doing workshops and other things, but it was very much front loaded and information being thrown at you. Councillor Elliott, please.
I'll unmute myself first. That's better, isn't it? Yeah, I thought the conference, it was a great opportunity to share experiences with other councils with the public health and the social care aspects. I've had conversations with other councillors in children and young people, and they found it extremely helpful this year. It was very children orientated, and they actually enjoyed having it online rather than the face-to-face. And I mean, one of them actually said she wonders if we'll ever go back to the way it used to be, that sort of forum. And obviously there's an expense there, isn't it? So money saving having it online, and she found it a great experience and highly recommend it. So whoever is in administration next year, I would highly recommend having some representation present there. Okay, thank you.
Councillor Purdue-Horan, do you want to make a comment?
Thank you, Mr. Chairman. I know this is a very popular and valuable and valued conference from colleagues previously. This was my first opportunity to join it, and clearly the style was a precedent-setting arrangement where everyone was sort of feeling their way to a degree. I did find it fascinating and invaluable for me, but fascinating to listen to contributions from professionals and councillors from other authorities. So yeah, overall I enjoyed it, but like you, I think I'm a bit of a conference animal that prefers to go to physical meetings. Yeah, it was interesting. Thank you.
Thank you. So I will move it. Do I have a seconder, please? Councillor Elliott, thank you. Any speakers? If not, we'll go straight to the vote. So Joe, please.
Thank you. Councillor Bosniak.
Yeah, we're just noting the report, aren't we? So yeah, I accept the report.
Councillor Butler.
Yes, noted.
Councillor Elliott.
Yes, fully supported.
Councillor Fielding.
4.
Councillor Garner.
4.
Councillor Harper.
4.
Councillor Martin.
Yes, definitely 4.
Councillor Purdue-Horan.
4.
Councillor Vickers.
Good.
Councillor Vice.
Yes, noted.
And Councillor Woodhead.
Noted.
Wonderful. That's been noted and that's carried by all members. Thank you.
Thank you. So now move to the final item on the agenda, which is the work programme, which you'll find on pages 59 to 62. Recommendation of the report set out on page 60 of the agenda pack is that the committee considers whether any amendments are required to the work programme. So I'll formally move the recommendations. Do I have a seconder, please?
Seconded.
Thank you. Joe, are there any changes to the work programme arising from the discussions today? I know we've got 2 speakers, but if you can just do your bit first, please.
Thank you. 2 items to pick up from the meeting today, which is the detail behind the Contain Outbreak Management Fund. and also the digital COVID response theme under the digital strategy.
Thank you. Councillor Wise, Muriel, please.
Thank you, Chair. It's not quite on the programme, but it is a task. I just wondered what your view is about this committee formally acknowledging David Pearson's knighthood as a former officer to the committee.
Yeah, thank you very much, Muriel, and thank you for the nudge on that one. Yeah, it is very important. He did a lot of hard work for this county. I've been really impressed with him. I found him to be very good, honest, and he always helps people to ask questions of him, which is quite a good quality he's got. Even if you used to ask him a question that wasn't appropriate, he'd find a way of bringing it into the arena and answer it. So yeah, we wish him all the very best, and perhaps we could send a message from this committee, if everybody's in agreement, saying how pleased we are and wishing him all the best, and how grateful we are for his services. So thank you very much for that, Muriel. That was an important nudge, that one was. Thank you very much. Councillor David Martin, please.
Yeah, following on from that, Chair, I'll reiterate both of your statements about David Pearson. He's a fantastic chap, and you know, if anybody's going to help us get that green paper written, it might be him. I don't know whether you already covered this, Joe, because it was very eloquently put, your additions to the work programme. But what I do want from somebody somewhere is a bit of clarity over whether we should be directing, whether the County Council feels that we should be directing people to websites like the Swift queue, or just leaving them as they are, because obviously the more tech savvy generations we get are going to be leaping onto that the longer the vaccine process goes on. So I do think we need some clarity over that as soon as we can possibly get it. Thank you.
Thank you, Joe.
Thank you. We could add it to the work programme for the committee, but I wonder whether it would be more appropriate for a message to go directly to all members, because I think probably remit-wise it sits more comfortably with the COVID committee. So if members would be satisfied, we could always ask Jonathan to provide that feedback for you.
Could I comment, please, Chair? It's
Yeah,
Melanie.
Corporate Director, please.
So the smart queue, it is an established mechanism for people accessing their primary care system. They can also do that through the NHS app. So many of us use the NHS app to do that. So that's the bit I would suggest members recommend. So Jonathan has already been in touch with the communications lead via email as a result of the questions that you raised, and we're also expecting that to be at the local outbreak management board this afternoon, one of the key areas of conversation. So I would suggest that we wait for Jonathan to clarify the message, and we'll get that out as a follow-up. Jonathan has all your contact details, so we'll get that out as an action following committee today rather than add it to the forward plan.
Thank you. Thank you very much. No more speakers on this one, so we'll move to the vote, please, Joe.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Garner.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Vickers.
For.
Councillor Weiss.
For.
And Councillor Woodhead.
For.
Thank you. That too is carried unanimously, Chairman.
Thank you, and that concludes the business of the committee today. Thank you everyone for attending. As we all know from the information we've been receiving, that we are at a very crucial stage of this COVID pandemic, and I would ask all of you please to stay safe. I know you will anyway, but heed all the warnings and everything, because it's really important. We've really got to knuckle down. So please keep safe and look forward to seeing everyone at the next meeting. Thank you very much. Please end the broadcast.
Bye-bye.